In this video, I'm going to talk about sleep apnea. Sleep apnea is where the airway collapses while we are sleeping and a person chokes. It can last for 30 seconds or more. As breathing stops, oxygen levels drop, which can cause heart and brain damage. It can make a person fat, tired, or depressed. Sleep apnea can cause brain fog, poor memory, make a person moody, anxious, or irritable. Sleep apnea can lower testosterone levels in men and estrogen levels in women and thyroid hormones in both sexes. Sleep apnea can cause gastric reflux as stomach acids are vacuumed up from the stomach when a person is choking. Diabetes, as every choking episode is followed by a spike in blood sugar, and high blood pressure as the heart races in pounds due to low oxygen. It can cause autoimmune issues, chronic pain, and chronic fatigue. Not only can sleep apnea directly cause 100 different conditions by interfering with our ability to heal, it makes every other condition worse. Okay, we don't want sleep apnea, but I don't have it. I'd know if I did, right? No, not really. A person can suffer from the early stages of sleep apnea for years and never know they have it. All they know is that they don't wake up feeling refreshed. This can go on for decades, and in many people it does. It's quite common for people to develop sleep apnea in their 40s and have it the rest of their lives without ever knowing it. But it can also show up in children, where it presents as a failure to thrive, stunted growth, and/or behavioral issues. How common is this, really? To be diagnosed with sleep apnea, you have to have your breathing stop 5 or more times an hour. Okay, how common is that? 84% of men and 64% of women over 40 have 5 or more choking episodes an hour, and the numbers only get worse with age. And it's not just older folks. 13% of kids have it too. And if we say that any choking at night is a problem, then those numbers would go up even higher. It's not okay to choke at all, not one time while you sleep. Let's talk about kids for a moment. The tonsils, adenoids, and other lymphatic tissue in the throat increases from birth to around 12 years of age, with a major increase between 3 and 6 years. This peak matches the incidence of sleep apnea increasing in children. We also see sleep apnea now showing up in older kids due to the epidemic of childhood obesity. We shouldn't think of apnea as a condition of the sickly, elderly, or obese. Even healthy-seeming people can have it. Even children can have sleep apnea. Okay, if it's so common and problematic, why haven't I heard about this before? Wouldn't I know if I had sleep apnea? No, not really. Doctors don't say anything because they're taught it's normal for a person to choke up to 4 times an hour while they sleep. And since it happens while we sleep, most of us just sleep through it. We just get used to poor sleep quality. Normal blood oxygen levels at sleep should be between 95 to 99%. But many people with apnea have blood oxygen levels that drop down into the 80s multiple times a night. Low enough to cause problems, but not necessarily low enough to wake you up. It's not until the symptoms get so bad that a person wakes up in the middle of the night choking, heart racing and pounding, sometimes sheets even soaked in sweat, that they know something is really wrong. Apnea doesn't get better with age, it gets worse every year. It's common for apnea episodes to become more and more frequent, for oxygen levels to go lower and lower, and for each episode to last longer and longer, until we eventually die from a heart attack or stroke brought on by these low oxygen levels. Many of us will die in our sleep, choking to death after years of senility, anxiety, and physical pain caused by sleep apnea. So, how can I tell if I have it? Again, if it's really advanced, a person will wake up choking, but most of us will have sleep apnea just bad enough to wreck our health, but not bad enough to wake us up. All right, so how can you tell? Well, you can get a sleep study done where you go into a lab and get connected to lots of wires and measuring devices. But that's expensive and requires a prescription. You can buy an oximeter from $100 to $1,500 that can measure your heart rate and oxygen while you sleep. Some of them can also be downloaded onto a computer or a smartphone and give you a graphic reading. Not only can these tell you if you have sleep apnea, some of them also have a vibration or audio alarm so that if you start to choke at night, they'll wake you up. Here's a reading from a Nonin 3150 of my sleep before I fixed my sleep apnea. You can see that there's a few spikes on the oxygen level. That's the lines going downwards, whereby oxygen level went down. And then quite a few more spikes on the bottom reading, which is my heart rate going up. Many of those times when my heart rate went up, I was about to go into an apnea state, and then my body dealt with it. Perhaps I moved around a little bit, I adjusted my position while I was sleeping. But the times where you see the oxygen level crash, that's where I was actually choking. And remember, this can happen up to 4 times an hour, every hour, and be considered normal. There's also a way to test if you have sleep apnea by checking the quality of your dreams, if you remember your dreams. It's simple. Are your dreams peaceful and pleasant, or are they frustrating and stressful? A frustrating dream, one where you're trying to accomplish something and can't seem to make it happen, is usually a precursor to sleep apnea. This can happen when the airway closes partway, not enough to cause you to choke, but enough to make it hard to breathe. This plays out in a dream as a frustrating dream, where you're trying to do something or solve a problem or go somewhere but can't do it. Why not? Because the problem you're having is labored breathing, and nothing you do in your dream will fix that in the real world. A violent or stressful dream is a sign you're actually choking at night. Also, dreams of you or someone being trapped or held down or being held underwater or being smothered in some manner, or generally violent dreams, are usually how the brain interprets choking during your dream state. But what if you can't remember your dreams? Well, that's a sign of sleep apnea as well. Sleep apnea causes a shrinkage of both the white and gray matter in our brains, and one of the results of this shrinkage is it becomes harder to remember our dreams. Sleep apnea can also cause dreams to become fragmented rather than continuous, being continually started and stopped by the apnea itself. Before I realized I had sleep apnea and got rid of it, I had very stressful dreams. I had them for decades and thought that was just normal for me. I got used to it. I never knew it was being caused by choking at night until one night, out of the blue, my apnea got really bad and started waking me up. Then I knew something was wrong. That's what put me on a quest to understand what was happening. What is sleep apnea? Why was I getting it? And what could I do about it? For decades, I slept over 8 hours a night and still woke up tired. Now I wake up after 6 hours of sleep and I feel more refreshed than I did when I used to sleep for 8. Well, better late than never. But before we get to what I did to get rid of my sleep apnea, let's learn more about how it happens. There are 6 main causes of sleep apnea. They are the gift of speech, congenital deformities, weak muscles, inflammation, biochemical imbalances, and stress. Let's go through them one at a time. The gift of speech. The gift of speech requires a flexible and elongated airway. Unfortunately, this also makes the airway less stable and more prone to collapse. Our gift of speech does not mean we will have sleep apnea, but it is something that we, human animals, are more prone to. Since there's nothing we can do about this, let's move on. Congenital deformities. In the 1850s, German chemist Justus von Liebig showed farmers that they no longer needed to care for their soils in the traditional ways. Compost and growing cover crops was old-fashioned, inefficient, and unnecessary. All they needed to do to keep plants growing year after year on the same depleted soil was to add nitrogen, phosphorus, and potassium to their fields. The result was mineral-poor food. The nitrogen, phosphorus, and potassium were there, but the calcium, magnesium, manganese, and other minerals were not. Fast forward to the 1930s, and grocers wanted foods that were shelf-stable for months, not fresh food that went bad in a few days. Scientists discovered that if you process food to remove certain vitamins and essential fatty acids, food lasts longer. The result was deficient processed food. We are now 7 generations into mineral-deficient food and 4 generations into eating vitamin and essential fatty acid-deficient processed foods. Every generation is weaker than the one before. Back in the 1930s, Doctors Price and Pottinger showed that in human and animal studies, eating mineral-deficient and processed foods were resulting in people being born with weak teeth and malformed airways. If you look at photos of native people from 150 years ago, they have strong jaws, wide faces, and perfect teeth. Cavities were virtually unheard of. Did you ever wonder why so many people need to have their wisdom teeth surgically removed? It's because their mouth is too small. This is the result of eating mineral-deficient processed food. Unfortunately, most of us have some degree of this. We have congenital deformities. While it is possible to expand the palate with certain dental appliances over the course of several years and at some expense, and this can help with apnea, we have no way of expanding the airway in our throat, and this is the main issue. The best we can do here is to take to heart the teachings of Drs. Price and Pottinger and make sure that gestating mothers take minerals and fish oil supplements. In this way, we can give the gift of proper airways and a lifetime of restorative sleep to our future children. But don't be discouraged. The human body is very resilient, and even with these two issues, we can still get a good night's sleep. There are 4 more ways that we can get sleep apnea, and if we take steps to avoid these 4 issues, we can have deep and restful sleep. Okay, let's get to them. Weak muscles. The human upper airway is a unique bit of anatomy. At the top, the nose has cartilage, and at the bottom, the trachea is made of cartilage. But in the middle, the pharynx, it is soft tissue with no support. As a result, it is prone to collapse. Modern airways are only about 1/2 inch wide, so there isn't much room for error. There are muscles in the throat called dilator muscles that keep the airway open. We also have the tongue muscle being pulled forward and out of the throat. During dreaming, however, all the muscles of the body relax. This is so you don't act out your dreams and hurt yourself or your partner. While the tongue and airway dilator muscles won't go into full paralysis like the rest of the muscles of the body, they still will become more relaxed, and as a result, the airway can get narrower. There are 12 different muscles that work to keep the airway open for us. The most important is the genioglottal muscle of the tongue. There's also the hyoid bone, which floats in the throat and attempts to create some stability, but it is inherently an unstable bit of anatomical architecture. The most important genioglottal muscle, the tongue, is meant to pull the tongue out of the airway with each inhalation. If it falls back into the airway, it can cause the epiglottis to collapse. Epiglottic collapse is responsible for approximately 75% of airway collapse. We discovered this with a technique called drug-induced sleep endoscopy, where a person underwent drug-induced sleep while a doctor looked into their airway with a fiber optic camera. This was an important discovery to make because CPAP machines, the breathing device commonly prescribed for sleep apnea, can worsen apneas that are being caused by epiglottal collapse. There are 2 main causes of issues with the muscles of the airway: obesity and weakness. When a person gains weight, we see it show up around their abdomen, but it also shows up someplace unexpected: the tongue. Here's a tongue that is 44% fat. This is an issue because it makes the tongue bigger, and the only place a bigger tongue can go is backwards into the airway. So if you have apnea and are overweight, this is something to work on. The second issue is physical weakness of the muscles, and yes, the tongue is a muscle. People with sleep apnea tend to have weak tongue muscles and airway dilator muscles. Remember, the tongue is supposed to move forward, and the airway dilators are supposed to constrict with each inhalation to keep the airway open. So what can we do to improve the strength and endurance of these muscles? Here are 2 options. If you get a TENS unit or an EMS stimulator like this, and these are available for about $100, you can strengthen your tongue and throat muscles. You take the electrodes and you place them here on the throat, and you may find that using a chin strap makes these electrodes stay on longer. You can use this to actually exercise the genioglottal muscle and some of the other muscles in the area. You can also use a special gel so that you could reuse your electrodes. If this hurts your teeth, turn the power down and or move the electrodes a little bit farther away from the jaw. There's also something called the replenish straw. And this is a special kind of straw, and when you use it properly, it also helps to strengthen the tongue. Finally, we can make major improvements in sleep apnea by changing the position that we sleep in. When we sleep on our backs, gravity pulls the tongue back, and this can cause the airway to collapse. While there are pillows and other devices you can wear to keep you from sleeping on your back, they aren't very comfortable. My favorite is to use the night shift. And what it does is it will vibrate when you roll onto your back. You won't even notice it happening. You won't wake up from it. It just cues you, reminds you to move off your back. And it can make a huge change for the better. It is more expensive, about $500, and requires a prescription. The next cause is inflammation. This can be due to allergies or infections. While the throat can become inflamed and cause problems, it's more common in the sinuses. Consider a drinking straw. If you cover one half of the top of the straw with your fingers and then try to suck from the other end, what happens? The straw collapses inwards. You don't have to cover the entire top of the straw. Just the suction and vacuum created by narrowing the airway can cause a collapse. And the same is true for the airway of our throat. Let's talk about inflammation a little more. Sleeping on our backs is one of the main contributors to sleep apnea, but it's also when the sinuses drain. So if we don't sleep on our backs at all, then the sinuses can get filled with fluids, and that can also trigger or worsen apnea. So how can we make sure the sinuses are as open as they can be? There's 3 more ways you can help to open your sinuses. 1, you can try adding more spicy foods to your diet. 2, you can either use nasal strips or nasal inserts at night to open the nasal passages. And 3, there is a therapy where lasers are used on the tissues inside the nose to tighten them up. This is called night lase therapy. Regarding the soft tissue of the oral cavity, the tonsils can also become inflamed. We have 4 tonsil groups: the lingual at the base of the tongue, and 2 palatine tonsils at the side, which are the ones you can see in the oral cavity. And these 2 groups protect us from the germs we swallow. Then we have the adenoids and a set of tubal tonsils higher up in the nasopharynx to protect us from the germs we breathe. If any of these tonsils become inflamed, they can cause apnea. This can happen from chronic infections of the tonsils, but also from inhaled dust or smoke, which the adenoids and tubal tonsils can react to. You can see when the palatine tonsils are swollen, but you can't directly see the other 3 types of tonsils. If you think you may have lymphatic involvement, you may wish to consider our Limplex product, 1 capsule before bedtime. Finally, if the soft palate, that's the soft tissue on the top of the roof of the mouth, or the uvula, the small bit of tissue that hangs in the back of your throat, are inflamed, or just constitutionally large, the same laser protocol mentioned earlier can be used to tighten these tissues as well. However, before you try this, consider going on an elimination diet. If your apnea improves, this may indicate that there is an allergic component involved. The soft palate is particularly prone to swelling from allergies. You could also try our Tessimet histamine product. If you find that using Tessimet supports your sleep for most of the night, but you still wake up with apnea at around 5 a.m., this may be the Tessimet wearing off. And if you can't get your allergies under control in any other way, you might want to consider using Tessimet once when you go to sleep, and then again at around 3 a.m. You might want to use a vibration-style alarm so you don't wake up your partner. If you're inflamed from infections, you could consider our Elagica and Zoibin products, both of which can also be used as mouth rinses. In terms of allergies, this is another issue we may not know we have. Most houses have mold. All bedding has dust mites, and many of us are allergic to them without knowing. These allergies can get worse as we lay in bed and can cause the sinuses to inflame, leading to apnea. Allergies often come with a high level of histamine. One way you can see if you have high histamine is with a dermatographic test. Take the back of your fingernail and drag it from the crease of your elbow to your wrist. The level of pressure should be uncomfortable but not painful. If it turns a little red, that's a histamine response. A little is fine, but the faster it turns red, the brighter red it becomes, the longer it lasts, and the wider the line gets, and especially if the line becomes raised and or itches. These are all signs of a histamine response. If you think you have a histamine issue, consider our Testament product. While we're on the topic of sinuses, we should mention nose versus mouth breathing. We don't eat through our nose, and we shouldn't breathe through our mouth. When we breathe through our nose, it helps open the airway. It does this in two ways. One, it releases nitric oxide into the airway to lower inflammation, and two, it triggers the airway dilator muscles to activate. If we breathe through our mouth, we get neither of these. One solution is to tape the mouth closed when you sleep. But remember, mouth taping should only be done if the sinuses are open. If you tape the mouth closed and the sinuses are blocked, a person will choke. There are two causes of apnea left, and both of these are associated with something called central sleep apnea. Central sleep apnea, as opposed to the obstructive sleep apnea we've been talking about, doesn't happen due to airway collapsing, but rather the person's brain doesn't give them the proper stimuli to breathe in the first place. Sleep apnea can be all obstructive, or central, or a mix of both. Okay, let's look at two causes of central sleep apnea. The first is a biochemical imbalance. We have special chemoreceptors in our heart, throat, and brain for monitoring our oxygen and carbon dioxide levels. The main trigger for breathing is actually not low oxygen, but high carbon dioxide. When we breathe, we take in oxygen and release carbon dioxide. Then in the pause between breaths, the oxygen goes down and the CO2 goes up. Once the CO2 level reaches a certain point, it triggers us to breathe, and the cycle repeats. However, if we're deficient in CO2 or carbon dioxide, it takes longer for it to rise up and trigger breathing, and this causes delays in our breathing. What can happen is that if the CO2 level takes too long to rise up, the oxygen level starts to drop in the meantime, and when it gets low enough, it can trigger us to breathe. But the reaction to low oxygen is much more intense than that of high CO2. High CO2 is normal, and the brain knows it just means it's time to breathe again. Low oxygen is an emergency signal, and the breathing triggered from low oxygen is much faster and more aggressive than that caused by higher CO2. It's an emergency response. When this happens, a person can hyperventilate, but this then causes their carbon dioxide levels to crash even lower, which causes the breath to pause for longer. When this happens, a person is no longer triggered to breathe due to rises of CO2, but crashes in oxygen. When oxygen levels crash, this is called the desaturation event. This kind of breathing is called Cheyne-Stokes respiration, long pauses with no breathing, followed by hyperventilation. Once this starts at night, it is a hard cycle to break out of and can go all night long. This kind of breathing is usually only seen in cases of sleep apnea and at the end of life before someone dies. So what can we do about this? We need to get the CO2 levels to normalize. I like CO2 on a blood test to be at 27. Too high, and I think about lung damage as a possibility, and for that you might consider our Alvectin product. Too low, and I think about chemical and metal toxicity because these can interfere with the cellular production of energy and CO2. You can directly supplement CO2 with sodium bicarbonate baths and our oral bicarbonate product called bicarbonate. I don't suggest taking sodium bicarbonate orally directly because it will neutralize the stomach acid. The benefit of bicarbonate is it only opens up in the small intestine, so we get the supplementation of carbon dioxide without neutralizing our stomach acid. There are two other ways that the respiratory triggers can be interfered with. One is if we have a problem with our C3, 4, and 5 vertebrae. The phrenic nerve is a nerve that passes through the cervical vertebrae at C3, 4, and 5 and triggers our respiration. If we have good posture, the ear canal is directly over the center of the shoulder. But for most of us, our heads are canted forward and we have lost our cervical curve. This places pressure on the phrenic nerve and contributes to central sleep apnea. I like to use the arch lifter. to restore a proper cervical curve and take the pressure off the phrenic nerve. Another cause can be chronic TMJ. You may be familiar with the mammalian dive reflex, which stops breathing and causes a slowing of the heart rate when mammals are dropped into cold water. Less well known is the trigeminocardiac reflex, which can also interfere with breathing and respiration. If you have TMJ, you may be triggering your trigeminocardiac reflex and may want to look at having this corrected. Finally, let's talk about stress. Stress is a normal part of life, and some stresses, called hormetic stresses like exercise, fasting, and hot and cold exposure, can be good for us. Chronic stresses, however, are not. We have two branches of our autonomic nervous system: the sympathetic, which is fight, flight, and freeze, and the parasympathetic, which is rest, digest, and repair. Every night we are supposed to get deep restorative sleep where the parasympathetic branch is dominant. Then during the day, if we become stressed, the sympathetic system takes over for a time. We evolved to experience short and frequent dangers: a saber-toothed tiger, a poisonous snake. Our stress response is geared to go from rest to emergency in a split second. What we are not designed for are chronic stresses: traffic jams, bills, difficult relationships, the nightly news. We have only so much ability to activate our sympathetic nervous system, our stress response. We have, in essence, a budget of how much stress we can handle. If we allow ourselves to get overly stressed during the day, we can use up this sympathetic stress budget and there is none left for the nighttime. You might think, well, why would we want sympathetic system activation at night? It's for stress, right? Yes, but not only for stress. The sympathetic system is also what activates our airway dilator muscles to keep our airways open. If you exhaust your sympathetic reserves during the day, there won't be enough available at night to keep the airway open, and this can create sleep apnea. When this happens, a person cannot access the deep restorative sleep that the parasympathetic system is trying to give them at night. This can result in the parasympathetic system overly activating during the day to make up for poor quality sleep at night. This can cause fatigue and brain fog. One classic sign of this is the tendency to nod off while driving. Historically, people started experiencing deficiencies in sympathetic reserve starting in their early 30s, but now we're seeing this happen to people much younger. There are ways to manipulate your parasympathetic-sympathetic balance. Potassium and infrared will increase parasympathetic tone, and magnesium and other calming supplements can lower sympathetic tone, but be careful. You will certainly feel calmer by increasing your parasympathetic and decreasing your sympathetic tone, but remember, you do need sympathetic to keep your airways open at night. So it's a little bit more complicated than we've been taught. The best way to handle this is at the source, the stress response itself. If you can stop getting stressed in the first place, you'll naturally have more sympathetic tone available to keep your airway open at night. This will allow you to get the deep parasympathetic rest and repair that you need. How can we do this? Meditation is one way, but there is a shortcut we can take. There are plant substances called adaptogens, which can attenuate the stress response. We make a product called Autonomous that contains specific adaptogens. Now that I'm taking Autonomous, what I find is I don't get stressed as easily anymore. When I do get stressed, it's not as intense, and it doesn't last as long. Sleep apnea forces the body to strike a terrible bargain. If your body lets you drift into deep sleep, the airways can collapse. So it keeps a person in light sleep. The person can get some rest, but not the kind of rest that the brain and body really needs. We can only do this for so long. Keep someone from sleeping for just a few days and they'll start to hallucinate. A little longer and they'll go completely psychotic. Dreams and sleep are essential for our physical and psychological health. So what happens? A bargain is struck. The body will relax and let the airways collapse, and then the brain gives you a micro-dream, at least 30 seconds, a minute. But during this time, the oxygen level is dropping, 95, 90, 85, 80, and at some point, the body will rouse you out of the deep sleep so that you don't have oxygen levels that crash to dangerous levels, and it recovers your airway. Your oxygen levels recover, and then the process repeats. Dreaming and or deep sleep that crashes the oxygen levels, then being pulled out of that deep sleep to get some oxygen again. It's like being waterboarded at night. This can happen hundreds of times at night without you even knowing. Choosing between deep sleep and oxygen is a terrible bargain because as the condition gets worse and worse, the person's brain has to accept lower and lower oxygen levels for longer and longer periods of time to get the fractured dream time and deep sleep they need to stay even somewhat functional. Left unchecked, sleep apnea can damage all 4 chambers of the heart in different ways, shrink the brain, trigger strokes, cause diabetes, and damage all the internal organs and glands. At a minimum, it can trigger the mammalian hibernation reflex. Hibernation is the 250 million year old program that lets life forms slow down their metabolism in times of limited resources. For bears, the limited resource is food. For people with sleep apnea, the limited resource is oxygen. What happens as a result? Well, we don't sleep through the winter like bears, but we can get low testosterone, low thyroid, and tend to put on body fat. We can experience this as fatigue and weight gain. If you're a man and you don't wake up every morning with an erection, that's low testosterone, and it could be from sleep apnea. If you're a woman with bad PMS or cramps, it could be hypoxia from apnea making it worse. We spend on average 26 years of our lives sleeping, 250,000 hours. Modern medicine says it's common to choke up to 4 times an hour or 1,000,000 times in the course of our lives during sleep, and that it's nothing to be concerned about. It's true that any single choking episode is uncomfortable but relatively inconsequential. But hundreds or thousands or more of these apnea episodes add up. It stresses the system. Apnea is a thief in the night, stealing health, vitality, and well-being. Sleep should be restorative, healing, and full of peaceful dreams, and it can be with just a few simple techniques. If you change your sleeping position, do some protocols to strengthen your airway muscles, lower excessive histamine, raise deficient CO2, and calm down your stress response, you may find yourself getting that deep restorative sleep you only remember fondly as having when you were a small child once again. If you have any questions, feel free to contact me at remedylink.com. Still here? Okay, here's some bonus material. ATP. Our bodies run on a fuel called ATP, or adenosine triphosphate. That's an adenosine molecule with 3 phosphate bonds. Each of these bonds can be broken to release some energy, and this is what powers us. As the day goes on, we use up our ATP, and it goes from ATP, that is 3 phosphate bonds, to ADP, that is 2 phosphate bonds, to AMP, that's 1 phosphate bond, and then simply to adenosine, with no phosphate bonds and no energy to give. We have receptors in the brain for adenosine, so when our adenosine levels rise to a certain point, that's how our brain knows it's time to put us to sleep. Then, while we're resting, we recharge the adenosine back to ATP. There is, however, a hack a lot of people use, and that's coffee. Coffee blocks the adenosine receptors. This gives us the illusion of more energy, but it's not sustainable. If you're sleeping 6 to 8 hours a night and still need coffee to wake up, you probably have sleep apnea, or at the very least, its lesser form, sleep hypopnea. That's where the airway doesn't collapse, but breathing is labored and difficult. The end result is still poor sleep. And of course, sleep hypopnea can turn into sleep apnea over time. Coffee, however, isn't the only way we medicate ourselves for poor sleep. Sleep deprivation lowers dopamine receptors, which causes a person to have less ambition and experience less reward for attaining their goals. Such a person may find themselves craving high dopamine experiences such as social media, video games, pornography, and gambling, as well as substances like alcohol, nicotine, and coffee. And if these aren't strong enough, drugs like amphetamines and cocaine and meth exist for them. REM is rapid eye movement and when we dream. REM dream sleep deprivation lowers GABA, a neurotransmitter in the brain. Low GABA can cause a person to experience anxiety, depression, autism spectrum, panic disorder, PTSD, depression, insomnia, seizures, tremors, and epilepsy, to name a few. Such a person may choose to use benzodiazepines like Xanax, Valium, diazepam, Klonopin, and Ativan. Sleep deprivation can also cause a person to experience low endorphin levels. Such a person may find life both emotionally and physically painful. Low endorphin levels take normal background physical sensation and make them painful. Think fibromyalgia and arthritis. Low endorphin levels also imbalance the Th1-Th2 axis of the immune system and can result in autoimmune disorders. Such a person may try to increase endorphins with spicy foods, sex, and intense exercise. Think runner's high. In terms of substances, marijuana and low-dose naltrexone are endorphin analogs. If these substances aren't strong enough, we have opiates like methadone, oxycodone, morphine, codeine, Vicodin, and fentanyl. A sleep deficiency can cause a person to experience low serotonin levels. Not enough serotonin can result in depression. It can also result in impulsive behaviors, phobias, dementia, cravings for sweet foods, GI disturbances, and irritable bowel syndrome. Such a person might try to increase their serotonin with SSRIs like Prozac, or even psychedelics. Then we have the antidepressant MEO inhibitors, which raise norepinephrine, serotonin, and dopamine. Then we have psychedelics. A psychedelic experience is very much like a waking dream state. Remember, the dream state is vitally important for our psychological well-being. I think it's possible that people who have a strong attraction to psychedelics are actually dream state deficient. So, do we have a drug epidemic or a sleep deficit epidemic? If you're concerned about your kids being exposed to and attracted to drug use, make sure they sleep well. Okay, that's the end of the bonus material. Take care and sweet dreams.